Hi, my name's Tahid and I'm an implant dentist based in the southwest of England. So I graduated in 2008 from Bristol University, and then I worked in a small place called Dursley, which is in South Gloucestershire. After a number of years and seeing the same patients for many years, I realised that there were lots of patients who inquired about restoring their gaps, and I didn't really know much about dental implants at the time, and so I used to send them on to other dentists who could do them. And then I realised that I needed to learn about them more, so in 2013 I started my implant training, and then in 2014 I placed my first implant. And then I realised that I needed to learn a bit more, and I wanted to further my knowledge. So I enrolled on the MSc in Dental Implantology programme at Bristol University. Now I dedicate most of my working time to placing and restoring dental implants and being able to provide my patients with that treatment option. So dental implants can be used to replace a single tooth, so a single implant crown, all the way up to replacing a full arch of missing teeth. So these teeth are often fixed in. Occasionally there may be some patients who come in who just want their dentures to be stabilised, they're removable dentures, and so we use a number of implants just to help stabilise their dentures. So it's very important to be assessed thoroughly, because often implant treatment is performed with the patient's needs and expectations in mind, and therefore planned accordingly. So this is something we hear quite often. A patient may come in and say, I've been told by another dentist that I just don't have enough bone for implants. Thankfully we're at a very advanced stage with implant dentistry now. We have sometimes the option of augmenting bone, so grafting bone. On occasions we may not want to do that, and we may want to use the residual bone. And we have 3D x-rays called CBCT scans that we can use to assess the bone levels. And so it's very important to be assessed thoroughly. It's very rare for us to say to someone that you just do not have enough bone for implants. And so on that note, seeing the right person who can provide you with the relevant options available to you is very important if you're considering implant treatment. So my advice to someone who's looking to go for some dental implants would be to firstly find a dentist who's comfortable placing them, who has enough experience with dental implants and has studied them well. Going on from that, some patients do come in and say that the cost is prohibitive. What I would say is to keep in mind that implants can be seen as a long-term investment. So the success rate of implants is 90% upwards following 10 years of analysis. So they really do provide you with a very good treatment option, a very comfortable treatment option, and so therefore knowing as much as you can about your treatment options and about the person who's going to be doing it for you is very important before you decide to go ahead. So on my website, drhamidimplants.com, I've outlined the treatment options that I'm able to provide, and I've also listed the various locations that I work in, so you can contact me directly through the website and select where you'd like to be seen, and then our reception staff will follow that up with a phone call and get in contact with you and arrange an appointment at your convenience.